I remember early on, kind of the first patient where we were concerned that this patient potentially had COVID. We had not yet had a COVID positive patient. And then it felt like before we knew it, we had a number of patients and we were escalating to filling our ICU with patients with severe lung injury, and then needing to prepare and opening new ICUs. And it was hard to know where the ceiling on that would be and how much capacity we could create. And all the while, just being really concerned and thinking about the notion of taking care of one of our colleagues. My husband works in the emergency department, and examining kind of who might be the first staff to get this, it was my closest colleagues, and that was really terrifying.
I mean, our entire group are like family, and then to have many of them sit down and sort of make their wishes known, like if this happens to me, only take it this far, make sure so-and-so is taken care of, these are my wishes at the end of my life. To have those conversations with coworkers is unusual, and was difficult. And then to have to go home and start to really think about what you would want for yourself, and to make sure that your wishes were fulfilled at the end of life was tough.
We were pretty worried about our colleagues, and in particular our more senior colleagues, with what we initially learned about the virus, thinking it would be more severe in people that were potentially older or had underlying medical conditions. And there was this motion towards more younger colleagues, trying to protect their more senior colleagues and wanting to just ban them from working. And then this more senior colleagues are saying, I'm best trained to do this. I want to be involved in this. I remember trying to tell my dad 95 different ways why he shouldn't work in an ICU during a pandemic as a pulmonologist or intensivist. And he wasn't going to hear it. And that's just, and same with our senior colleagues here. That's just so inspiring that you kind of have an easy out. and there's a desire for us to protect our colleagues, and some people came out of retirement to jump in and help with the pandemic. That's just...
I know. It's like, no offense, kid, I think I know what I'm doing.
Yeah.
You know what I mean? Yeah. I'm glad we failed at that, trying to keep them out of the ICU.